Hello, my name is Christine Warner, and I am a registered nurse. Today I am here to represent congressional legislation sponsored by Jeff Merkley, a Democrat from the state of Oregon. I will be discussing my support for the Registered Nurse Safe Staffing Act. The Registered Nurse Safe Staffing Act is a bill that strives to provide protection to patients through staffing ratios. Working as an RN and a charge nurse, I have a direct correlation to this bill and why it is so important for healthcare systems and patients. The purpose of this video is to outline my support for this bill. A central issue of concern for the healthcare industry is patient safety. In the year 2000, the Institute of Medicine published a report about quality and safety. The report is known as "To Err is Human: Building a Safer Health System," which outlines some alarming data. The report noted that 98,000 deaths were caused annually due to medical errors. Since patient safety in hospitals is directly proportionate to the number of registered nurses working in the hospital, higher staffing levels by experienced registered nurses are related to lower rates of negative patient outcomes. A 2012 study of Pennsylvania hospitals showed that by reducing nurse burnout, which is attributed in part to poor nurse staffing, those hospitals could prevent an estimated 4,160 infections with an associated savings of over $41 million. That study also found that for each additional patient assigned to a registered nurse for care, there is an incidence of roughly one additional catheter-acquired urinary tract infection per 1,000 patients, or 1,351 infections per year, costing those hospitals as much as $1,100,000 annually. Registered nurses play a vital role in preventing patient care errors. A 2009 study found that sufficient staffing of critical care nurses can prevent adverse patient events, which can cost anywhere from $2,200,000 to $13,200,000. By contrast, the nurse staffing costs in the study time period were only $1,360,000. In conclusion, I support the RN Safe Staffing Act of 2014 because patient safety should be a central concern for all providers. Less sentinel events and medical errors can be made with more nurses at the bedside, and the cost of paying a nurse is less than the cost of paying for adverse effects. And there is no cost to a patient's life. Thank you.